Today we're visiting a very special and resilient family in Kinmen that is headed by 40-year-old nurse Chou Ya-hui. Both Chou and her husband worked at the same hospital in Northern Taiwan at one time, she as a nurse anesthetist and he as a surgeon. In 2012, the husband had a stroke after being on duty for 32 hours, and the responsibility of the family fell on Chou's shoulders. By chance, the family of four relocated to Jinhu, and eventually Chou became the first home care nurse on the outlying island. Here's her story in our Sunday special report.
In Jinhu Village in Kinmen, Chou Ya-hui, a home care nurse, travels from one door to another. Carrying a nursing kit, she's on her way to the home of 99-year-old patient surnamed Guo.
你好，嗨，大姐，肚子饿了，肚子饿，等我一下嘿，我先换鼻胃管。
To the patient's family, Chou is their savior.
我觉得她真的很有爱心，耐心做，真的是一大贵人，真的是。
大姐真是太会讲话了。
They have high regards for Nurse Chou, who's taken care of their grandma for almost 2 years now. Once, the old lady injured her toes, and it was Chou who helped tend to her wounds.
你看她那个灰指甲。
Grandma's toes had a fungal nail infection. She said they needed to be cleaned and disinfected, then carefully trimmed. She sat here on this tiny stool for 2 hours trimming Grandma's toenails, and she helps us with that every couple of days. She's really kind and patient. She's someone who's changed our life for the better.
Chou usually treats patients who have just been discharged from inpatient care but still have various catheters inserted or score lower than 60 for their ADLs, abilities of daily living. Conventionally speaking, Chou would only be required to visit each patient at their home 1 to 3 times per month, but she goes above and beyond that, trying her best to show up whenever she's called on.
一天会跑到8个病人，有点赶。
She's known across the Jinmen archipelagos. For a time, locals thought she had to be born and raised in Jinmen, being so dedicated to the elderly patients.
妈妈你好，放轻松哈。
But Chou is in fact from Taipei, and only moved across the Taiwan Strait to Jinmen 8 years ago due to a family tragedy. Chou's husband Zhang Haocheng's right side is completely paralysed. He can only walk with a 4-legged crutch. Now 45 years old, Zhang had a stroke 12 years ago at the age of 33. Through all these years, Chou was by his side for rehabilitation.
因为他是张力型的中风。
He has hypertonia from the stroke, so he has to have something to hold. Otherwise, he'll get spasms.
Apart from training motor skills, Zhang is also in speech therapy.
你要听吗？要念清楚哦。等一下，你听得懂他讲什么？你要讲到他们听得懂才能下课。等一下，你讲正面这一句就好了。
璀璨生命的祈祷。
璀璨生命
的祈祷。
他的智商啊。
We did a follow-up IQ test. His cognition wasn't compromised.
Before he got a stroke, Zhang was a colorectal surgeon at a well-known hospital in Northern Taiwan. Chou was an anesthetic nurse at the same hospital. There is great affection between the couple.
最主要是浩辰很疼她，他甚至半夜。
Hao Cheng really cared for her. Even in the middle of the night when she really needed to go, he'll carry her to the bathroom. Can you say the same for most other men?
The couple lived comfortably as medical professionals until 2012. Chou was pregnant with their second child when tragedy fell on the young family. In July that year, Zhang had just gone off duty at noon before rushing to ER, not to see a patient, but for a searing headache.
那一天
He collapsed right there then and was rushed to the surgery room. I made a quick change into surgical scrubs. My hands were shaking while I was about to inject him with anesthesia. I remember it was Dr. Lin, the anesthesiologist, who held my hand to stop me and said he'll take over for that instance. So I retreated to the room next door. I couldn't stop vomiting while there.
Jiang survived after 2 craniectomies, but he was in a coma after the surgeries and was in intensive care for 2 whole weeks.
When we found out it was the day after, we immediately went to see him. He was already in the ward and seemed to be almost gone, not making any sound. His mother and I were absolutely devastated.
Jiang miraculously awakened, but in a vegetative state.
The doctor told us it was no longer worth putting in more resources or undergoing more treatment because it's likely he'll remain in that state. But one day I asked him if he could hear me and to blink if he could, and he did blink.
Under Zhou's meticulous care, Jiang went from being able to blink to regaining movement in the fingers and gradually his memory. The recovery was clearer by the day. But by then, Zhou was on the verge of a breakdown and even thought of giving up their unborn second child.
I asked her why she didn't get an abortion, and she said she was actually already going to. She's already gone to the doctor. The doctor did an ultrasound, and it was probably at that moment that she reconnected with the baby and regained her courage to go on.
Zhou decided to continue fighting because she wanted to hold the hospital accountable for her husband. Why would an otherwise healthy individual at the youthful age of 33 suddenly get a stroke?
The day before the incident, he's been on duty for 32 hours. Once I got the record, I passed it on to a senior colleague in occupational medicine, and she showed it to the physician, who took a look and said the hours isn't normal at all.
It turned out Jiang had collapsed under an immense workload. Zhou then filed a lawsuit against the hospital. She won on the first ruling, but during the appeal, the hospital settled with Zhou. They were compensated but lost their jobs at the hospital.
I got a fraudulent call. They told me that I owe money to Zhonghua Telecom and that I'm going to be sued. I looked at the bank account balance and said I had no money. My husband had a stroke, and now this? I broke down in tears. Even the fraudster ended up consoling me. So then I thought I couldn't carry on like that. My life, my children's future will be ruined. I had to go back to work.
A new opportunity came. A medical lab scientist who's about to set up a health check clinic in Jinmen learned what the couple had gone through and invited them to join the team.
I looked up how things are in Jinmen and found that you don't have to pay tuition in public schools, at most 200 NT per semester. What's more, healthcare is also free of charge, including registration fee. So I thought Jinmen was a good place for us to make a living at the time.
Even though they'd never been to Jinmen, Zhou believed it was the opportunity of a lifetime, so she decided to uproot the family and move there. But the great start to her new life did not last long. After several months at the clinic, the owner could not afford to pay her, so she had no choice but to quit. Her husband still had to do ER runs every so often, and the kids had not yet reached school age. Family obligations meant she couldn't work full time, so she made do with various odd jobs.
When she first got here, she was really lost. She's done insurance sales and part-time minimum wage work. As long as there's money to be made, she'll do it.
One day, a friend working at the county health department told her about a new way to really settle down.
Hello, Ya-hui.
To meet demands due to the rollout of the Long-Term Care 2.0 policy and community care, in 2016 the Ministry of Health and Welfare introduced 2 in-home care initiatives. With encouragement from the health department, Zhou began her practice as the very first home care nurse in Jinmen. Coordinating with the health department and local clinics, she began providing nursing services at patients' homes.
In the past, it was difficult to travel to Liu, so health practitioners are less willing to practice here, so we need more in-home care. In the beginning, Zhou had to take the ferry here when she worked with me, Sometimes the patient's catheter will fall out, and with a phone call, she has to take the ferry here immediately after.
The greatest advantage of Joe's new work is the flexibility. When there's no one to take care of her husband or the kids, she can take them along.
I think people here are also kind. I'm supposed to be the service provider, but often it's the patient's family that ends up helping my husband and encouraging us, saying he'll eventually recover.
Whenever I need medical advice, I think of her first. I think she's even more capable than a doctor. It's really great that someone from Taiwan is willing to come to Jinmen.
Being a family member of a long-term patient herself, Joe easily gained the locals' trust.
我遇过一个阿嬷，因为她老公中风的时间比我老公短一两年。
I've met a grandma. Her husband also had a stroke, a year or two later than my husband. She would sometimes say, "Why wouldn't my husband die already? There are so many bills to pay, the migrant worker's salary and the baby formula." I tell her about what I've gone through to let her know that my husband also had a stroke and she's not alone.
你等下帮我把这些资料提上去哦，可以哦。
With her words of encouragement, the patient's family pulled through. Joe had rebuilt her life. Her parents-in-law also moved to Jinmen to help care for her husband and 2 daughters. The family is now doing much better.
弟弟这样陪伴我。
他每天的，他每天就是提供满满的情绪价值。他每天都会睡前都会说，老婆你又变漂亮。
Although the tragedy that had befallen her husband was once a great trial, with perseverance she's changed the fortune of her family and touched the hearts of elderly patients in Jinmen too.